Hey guys, welcome to my video on the shoulder joint. So actually, when we talk about the shoulder and we talk about the history, if a patient's complaining of a shoulder problem, they're going to complain of weakness or pain or stiffness. And in your history, you're always going to find out if the patient has any systemic diseases or any previous similar complaints or a history of trauma. So with a shoulder exam, and I'm going to start off by actually just a brief explanation of the rotator cuff. The rotator cuff is basically a protective covering for the shoulder joint. It's formed by the tendons of the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. And this is a lateral view of the shoulder joint, and this is the humerus. So when we do range of motion testing, and that's after you've done the inspection and palpation, there are certain movements that you test. Now, with the shoulder joint, and these, of course, there's an overlap. There's a definite overlap, like most of these movements have multiple muscle tendons and muscles at work. So the main two that are really important are abduction and this external or lateral rotation. So when we talk about abduction, and just for a recall, this is a patient. That's the patient's arms. And they're moving, so this is 0 degrees, and this is right at their shoulder is 90 degrees. So they're abducting out this way, and you actually can isolate muscle action. And that is because from 0 to 15 degrees, so 0 to 15, you can actually isolate the supraspinatus. So up until 15 degrees of abduction, you have just the action of the supraspinatus. And after 15, it's the deltoid. So I'm going to write here supraspinatus and deltoid. Abduction is also important because it's a parameter for two things. It's a parameter for tests for examining the extent of adhesive capsulitis, and for something called an impingement test. In terms of external rotation is if the patient has and I'm going to show a side view, the forearm is flexed, and the patient is moving the forearm outwards. Now, this is mainly due to the action of the infraspinatus. The teres minor is also involved, but really you're isolating the infraspinatus, and that's really important. So now on to the type